just signed out. Now it's time to tune in. Welcome to Sign Out with Kyle the PA, the commute companion for PAs, PA students, and pre-PAs. Real stories from real PAs across every corner of the profession. Your journey continues here. Here's your host, Kyle the PA.
Hi, everyone. Welcome to the show. This is Sign Out with Kyle the PA, your go-to show for the commute. I'm Kyle, bringing you stories and candid conversations with interesting physician associates, especially those making a difference in Asian health across the country. Tune in for inspiration, laughs, and insights to kick off or end your workday right. On today's show, we have Anita Lee. Anita Lee is a physician assistant with over 17 years of experience in adult and pediatric medicine, who is currently the director of advanced practice providers at Rendr, a primary care focused multispecialty medical group dedicated to serving the Asian community in New York City, with over 100 offices in Brooklyn, Manhattan, Queens, Staten Island, and Nassau County. She graduated from Seton Hall University PA School and holds a master's degree in management and health policy from Columbia University Mailman School of Public Health. Anita, welcome to the show.
Thank you. I'm so happy to be here.
We're glad to have you. So I think, first and foremost, for our listeners who are not familiar with Rendr, do you think you could just tell us a little bit about what Rendr is, what you do?
Sure. Well, I should explain a little bit about Rendr and the history behind it. I think it's pretty cool about how it came into its current format or organization structure. So about 6 years ago, the initial merge happened where 10 legacy solo offices in Chinatown, New York merged together, and they formed the initial Rendr legacy offices. So that was the first merge. And then subsequent to that, about 2 years later, we had a second merge with another big Chinese primary facing practice group, Excelsior. And it's grown a lot. It's, over 100 offices all over New York City, predominantly serving the Asian patient population. What sets Rendr apart is we're a value-based care company, a little bit different than a lot of the primary care offices out there. And so we're moving from what's called a previous fee-for-service model and teaching our providers to give care to our patients under a value-based care model.
Awesome. Wow. Okay. So Rendr is comprised of, from what it sounds like, lots of different practices of, Asian primary care providers and different specialties who, with the purpose of serving Asian communities in New York City or in New York, in this kind of like a New York area, including, I guess I shouldn't say just New York City because Nassau County too. And you're specifically serving the Asian community. What made you, or what drew you to Rendr? Did you always know that you were going to work in a practice like this? Have you always had an interest in working in like an Asian community based or focused kind of clinical practice?
No, I did not start out in a Chinese practice. I started out in a FQHC. So this is almost 17 years ago. So my primary focus when I came out of PA school was, one, pay off my student loans, and two, get as much experience as possible. So I knew at that time they had a program with the federal government. It was called the National Health Service Corps. And so I think if you served in a underserved medical area, there was a partnership, a loan repayment program, a certain amount of years served, and they would give you like a loan repayment. So I did that for about 5-6 years in Bedside, Brooklyn. I worked in a school-based health center for those 5 years. I basically ran a small clinic inside a school. All the elementary school kids were my patients, and I took care of all their needs. So that's where I started. And once I paid off all my loans, and this is like 6 years into my career, I moved to, get more experience, primary care, adult medicine, pain management, and outpatient vascular surgery. Yeah, so that's
Wow.
where, I didn't know I would end up at Rendr, but I think there was always that desire to serve the Chinese patients. My parents are very hardworking immigrants, and I always felt like I grew up in the area where I eventually worked at. So that's when my parents immigrated to. So, it was really always close to my heart.
Wow, wow. That's very cool. But the one of the things that stands out the most to me is that you started in, pediatrics for 6 years. I feel like when I looked at your LinkedIn, you had worked in so many different types of specialties that I wouldn't expect someone who, especially someone who starts in pediatrics, to go into. So you went from pediatrics, then you did adult medicine, then you did outpatient vascular surgery, then you did pain management. It seems like you've covered a broad range of, specialties in your career, which I think most people would probably be too nervous to kind of, dip into these different types of, pediatric medicine, then adult medicine, then, a surgical subspecialty. But one of the ones I'm really interested in, well, actually, no, first, what made you decide to go through all these different specialties? I guess that's, because that is,
Yeah, I was, once people found out I was a PA, a practicing PA, some family friends or, people I knew needed help. And so I
uh,
actually worked like at some point 6 to 7 days a week. And so my full-time job was like 4, and then I would do another 2. My whole goal the first like 5 years of my career was to really not have loans and just get as much experience. So
yeah.
that's outpatient vascular surgery was like once or twice a week. And so I got experience from that, lower extremity diseases. And, eventually I moved to pain management neurology, which I loved. But you know, it just sort of everything aligned really well that they were looking for a provider at my Chinese practice that I worked out previous to Rendr's merge. So I ended working there 5 years before Rendr actually came in.
Wow. Were you
Mhm.
working at these places like overlapping, like simultaneously at some of these,
Some of
different.
them were overlapping. Yeah, yeah, yeah.
And I think that's I love that I love that we're talking about this because obviously we work in a profession where that's a possibility. You can work in pediatric medicine and adult medicine and vascular surgery and pain management all at the same time because our profession allows for that kind of flexibility, this kind of training that allows us to work in different specialties. But I think it also is a testament to this idea that I'm a big, advocate for, which is that, we don't need to be fully committed or locked into just one thing at a time. Like you can be working in one field, and then if you're interested or you have an opportunity to work in another field, whether it's just part time or per diem, like you can do that, and you don't have to it doesn't have to be like a full stop on one specialty or career and then starting all over again. Like for example, like I do clinical medicine and advanced GI inpatient, but I also work part time for like a health tech company, helping them build one of their AI models for medical scribing and billing and coding. And I wanted to see what health tech was about, so I just decided to do it part time. And it's nice. I can do both, and it gives me a sense of what that outpatient or not outpatient but non-clinical world looks like. But that kind of brings me to my next point, which is that on top of everything that you've done as a PA clinically, you also went back to school to get your master's in management and health policy. Talk me through, what led to that decision. Where did you want to see your career after that degree? And, why did you decide to go back to school?
Yeah. So that was just after PA school. Let me backtrack just a little bit. So I always loved to do medical missions work. So I've been
Mm,
on several medical missions uh, during PA school, afterwards, and even like prior to PA school, patient education in different countries overseas.
mm,
So I always knew I wanted to be clinical, so that's why I went the PA route. And I always was interested in, just the world and how healthcare worked. So,
mm,
it was during my time at Bed-Stuy, running the school-based health center. I took night classes. And so I went from Bed-Stuy, Brooklyn, took the train all the way up to Harlem.
Wow.
I did my coursework on the train. And so that was
Wow.
just always in the back, if I needed it. And plus during my time at the school-based health center, it was me and my medical assistant. So I had some opportunity to run my own little office. So I started, learning a little bit more about the management aspect of stuff. So I think that's where my curiosity was piqued. I love being forward facing, and even when I joined Rendr, I only went full time management about 2 years ago.
Mhm.
Prior to that, I actually did. I still practice as a forward facing clinical provider. And then about 2 years ago, the load was just a little bit too much. And so, Rendr kept expanding, and there was a leadership opportunity. So yeah, I went full time as a director for the APPs.
Wow. Wow. You're a hustler. Doing the bedside of West Harlem commute is that's wow. And doing your
Yeah,
school. Wow.
it's
Okay.
crazy. Never
Yeah.
again. Never
Yeah.
again.
That's impressive. Wow. I guess one of the things that I feel like a lot of, I feel like there are a lot of people who become PAs. They were go-getter students, and they get out of PA school and they still have this go-getter attitude. And I know a lot of PAs, especially folks in New York City, and New York City, we're full of hustlers, who always think about like, oh, should I go back to school? Should I get an MBA? Should I get an MPH? So I guess as someone who's done it, and this is, I know we had certain questions that we are going to talk about, but now it's just making me think that I'd love to ask you this question. As someone who
Yeah,
did go
no
back to get
problem.
their master's,
Mhm.
what do you think about it? What do you think about going back to school again, getting another degree? Do you feel like it's helped you? Do you feel like it hasn't? Do you feel like you could have gotten the same knowledge and experience without it? Would you recommend it? I don't know.
Um, well, there's a lot of opportunities for PAs out there, and it
Mhm.
always have, and there's a lot of opportunities for management, and it always looks better if you have an extra degree under your belt as well.
Mhm.
Could I have done it without it? I think part of it is tied into personality as well. So maybe I could have succeeded, but it definitely did help because I do have the manager skills right off so I didn't realize I had it, but the classes I took did help with that. I have the bigger vision thinking, which
Mhm.
sometimes is required when you're the director or the manager of overseeing or lead overseeing a group of providers. So it's helpful. It's just extra education, which as providers we are always trying to seek and learn more stuff about healthcare.
Yeah, yeah, absolutely. And I feel like I do see that difference with folks who did go back to school and get another degree after the PA degree. Like I can tell that there's another level of understanding and knowledge about, you know, beyond clinically, because obviously in PA school, like we really it's just clinical knowledge that we learn. And
Right.
there's and then as I feel like go through your career, you're like, oh, so much of this job is not clinical. So much of this job are workflows, efficiency, operations, management, and you don't learn any of those things when you're in
Yeah.
PA school. And
Mhm.
so, that's why I was so curious to ask. But going back to your role in Rendr, you said you were fully clinical. Now you've kind of switched to, it sounds like, completely like a leadership, administrative, management type of role. So what's his like a what's your day to day, week to week look like? I'm sure a lot of people would like to know, as folks who are interested in going into like a more leadership type of role as a PA. What does that
Yeah,
look
yeah. So it's actually a very exciting time here at Render because when it merged, I always called it a startup. Like literally we had nothing, like I remember, it was COVID when we finally merged. And one of the
at the
leadership,
time?
yeah, and I had, just had my second baby. And one of the leadership had called me. I was like, hey, do you want to take this position to help this team? It's fully remote, blah, blah, blah. And I was like, okay, but I still want to see patients. And then, I eventually, after a year or two of doing Render 360, which is sort of the back end team for Render, and we have a team of clinical providers there, PAs and NPs that do a lot of the behind the scenes clinical stuff for our providers on the front end. So lab work review. So there's sort of like in boxology, it's just they do second reviews for charting and all that stuff. So it's a whole back end team. So, there's opportunity if, if you're facing that, like, hey, do I still want to remain clinical? We do have a back end team as well that are they do the back end stuff. For me, my day to day after I became the director was really very different every single day. I have study programs that I help run. So I have a CME series that is provided for the PAs and NPs. It's a case vignette series that we have every single month. So a lot of educational stuff because, like I said, we're not fee-for-service or value-based care now. And so a lot of education goes to teaching our providers about that. PAs and NPs also, and they, I think every provider, PA, NP, MD, DO, they continuously need to be learning the new best treatments, the best practice. So education is a huge part of what I do. I also do a lot of one-on-ones for my PAs and NPs. So currently we have about 80 to 90 forward-facing PAs and NPs at Rendr. They're all in different specialties and mostly in primary care. And so I try to meet up with them at least once a year. Some of them a little bit more if they need a little bit more help in certain areas. I also do the screenings for all new provider potentials, hiring, just making sure Rendr is a good fit for them. So, just a couple of things I do in a nutshell.
Just a couple things, just a few.
Just a couple of things here and there, but
Wow. That's cool. The education part, I wouldn't have guessed that, because I feel like, there's always a lot of folks who are interested in getting into education and educating future providers or like students, but I don't know if anyone will ever consider the possibility that there's education opportunities within the profession that doesn't involve a university or an academic institution. But it seems like that's a huge part of what you do, which is really, that's really interesting. And it sounds like you're doing a lot, especially with that many APPs at your company. And, we had talked about this obviously on the phone before tonight, but I'm sure people listening and people who are curious about Rendr obviously starting to think to themselves or wondering, like, who is Rendr looking for? Like, who would they be interested in hiring? Like, do I have to speak Chinese? Do I have to be Asian? And then you had said something funny about, I told you, I was like, oh, wow. I was like, this seems like such a cool company. It's too bad my Chinese is bad, as a classic ABC. And then you were like, I said something about like how my Chinese is really only like conversational with my family. And you were like, that's actually perfect. Or like that's because when you're talking to patients, you don't need to be able to use all this complex terminology all the time. So, who are you looking for at Rendr? What kind of providers are you interested in? Like, who are you looking to hire? Who do you hire?
Yeah, I mean, it depends on the office. So, if you're hiring for predominantly language is a requirement, so Mandarin or one of the Chinese dialects, it's definitely needed. Mandarin, and usually having a second dialect really does help because you don't know who might walk into the office or what patient you might be seeing that's new or which dialect they speak. We have a couple of offices that are non-Chinese. And so for those practices, we do have, just English-speaking providers. But predominantly, it is a language requirement. It's really dependent on the office and where you're situated. If you're at headquarters, some of them, they might not. But I would say majority of them, we do have the language requirement for them. So, mostly like myself, like you, ABCs would be probably, if you're interested in Rendr, those are the people we're looking for. Someone who wants to give back to the Chinese community, maybe parents who are immigrants, that's a lot of the PAs and NPs that I work with.
That's really nice. I think I feel like it's not something that folks think about when they're younger or teenagers, but I feel like you do reach a point when, you're in your 20s, 30s, you start thinking about, like, how did I get here? who are the people in need, and then you start seeing your parents as these, like it's hard for me to see older Asian folks in the hospital and not see a little bit of my family, a lot of my parents in them, and then begin to picture what it's like for my parents when they go to visits and appointments, and how much they might struggle, and how much they could really benefit from an Asian provider and some language concordance, some race concordance, some cultural concordance. And so it's good. It's great to hear that there's so much work being done by Rendr to try to help close some of these gaps and fill into some of this need for this vulnerable population that is so large in New York City. But I do want to try to get to some of the other questions that we have, or that I have for you.
No problem.
It's not every day that I get to speak with someone who's in a leadership role as a PA, and I feel like there's a lot of people who are interested in going into leadership roles, and especially post-COVID, during COVID, I think there's a lot of PAs who are interested in roles that are a little bit more hybrid or remote, that have a little bit more flexibility. So do you have any tips, advice, things that you can offer to people who are interested in transitioning into more leadership or administrative kind of roles in healthcare as PAs?
Yeah, I would say that if you're interested, then, start considering maybe getting more education, a second degree. If you are a PA, then I think you should be the best PA first, be clinically excellent, be a team player, and learn everything you can. And then if you're looking into leadership, then when the opportunity comes to lead or, take on extra projects, definitely take it on and do a good job, make sure it's done well. And, people are always looking for who's going to be next. We are in a career that it's a pretty big shortage. So, I think if you're really looking to step it up as a leader, there are opportunities out there for the PAs. PAs definitely plenty of opportunities. We just have to, be proactive about it to find them.
Yeah, and I was just speaking with another one of our PAs who's going to be who was on the show yesterday about this, and I feel like she said very similar things to you, that like there is a need when like places always need someone to step up, and she kind of gave very similar advice, like just be prepared to step up. Don't just be that person who complains about a problem. Be the person that is willing to try to fix the problem. And collaborate with folks to fix that problem. And so, I feel like the reason why I asked too is because I just always wondered as well, like, how do PAs find themselves, like making the transition to a leadership role? And, now I appreciate this advice. It's something that I'll be thinking about, and hopefully listeners who are interested in maybe going to leadership roles or administrative roles will think about it too. So, obviously, you've had a very decorated, vast career as a PA, as a leader, as a clinician. You're 17 years into your career. You're already very accomplished, and presumably will work for many more years as a PA. What do you see in your future? Where do you see your career going?
Yeah, making me feel very old, but
No,
yeah.
experienced, knowledgeable, expert,
I
veteran.
was thinking about that. And I would say, I'm really happy to be a PA. If I went back, yes, I would still be a PA. I love our profession a lot, and I think it's going in the right direction. And so, if it's 17 years, I'm pretty sure I'll be retired. But during that track upwards,
About
I would
7
say,
years.
okay,
Yeah.
like 7 years, still hopefully either doing what I'm doing, education, advocacy, or maybe going back to patient forward facing too. At some point, I would love to start seeing patients again, to be part of that like change, and then to be the feet on the ground as well. So I don't think even in leadership, seeing patients is still like priority so that we know what's going on in the site level as well. So we'll see. I don't know. I'm pretty open to many things. Rendr is very exciting. We keep building up things, so we'll see where it takes me. And yeah.
Nice. It's funny. One of the questions that I had written down that I was going to ask you was like, do you miss the patient-facing stuff? Do you miss the clinical work? And
I do. It's so stressful though, but it's a different type of stress. Yeah, management is very different than when you're patient, when you're, clinical. Patients, you can sort of just have them exit the room, after 15, 20 minutes. Management's different. You're still working with that same team over and over again. And you're more of a visionary in casting and directing people and managing people, the same team. Patients you can manage, but it's 20, 30 minutes and they're on their way. So it's different. But if I'm serving the patients as director, ultimately healthcare organizations is here to serve our patients to make sure their health outcomes are better and they're managed better, then I need to also have my feet to make, in the pool to make sure that I'm understanding what's going on as well. Yeah.
Yeah, I feel like that's spoken like a true leader. I feel like that's spoken like a true leader because I think that's one complaint that I think that you'll hear from a lot of clinicians is that they feel like their management and their leadership doesn't understand the problems they're experiencing on the ground because they feel like their leadership and administration is not on the ground with them. And so it's great to know that that's not the sentiment from every leader and administrator in the healthcare field, and that you understand the value in that. But we are kind of getting towards the end. One other thing that I wanted to ask you as someone who's has a lot of years of experience as a PA, and this will probably be kind of like my final question is there anything that you wish you knew earlier in your career? I mean, and I ask you this largely because it sounds like you've made so many great steps in your career. You've made so many right decisions. Is there anything that you wish you knew sooner? Or is there anything that you're glad that you did do or steps that you did take and you're like, yeah, I would have done the same thing again. And if I had the opportunity to tell another PA early in their career, I would have said this to them.
Yeah. I think for me, it worked out like according to how I planned. There's certain areas that it didn't work out in, but that's just for me, like how life pans out. Some things are how it's meant to, how you think it will, and some things aren't how it ends up. I would say that one of the things I would, tell newer providers, PAs, is that figure out things that you enjoy. Know who you are first. So if you know who you are, what makes you tick, what makes you angry, what makes you happy, working as a PA in our current healthcare system is exhausting. And so you need to find things that keep you joyful and happy. So hobbies and stuff to keep you, grounded and not burnt out. So, and I also would say that life, you go through phases. Early in my career, I focused a lot on my academics and being the best PA. 17 years in, I'm a mommy to 3 kids. And so that there's a shift in what I need to do. I still love being a PA, but, priorities of family life and then work-life balance is also there as well. So, yeah, I mean, there's seasons in life where you have to put in more effort as a PA, and depending on what goals you want to accomplish as a PA, and then what other goals you want to accomplish. So know yourself first is what I think is key. And, key to success. Like, if you don't know who you are, I don't know how anyone else is going to tell you, like, what you should and shouldn't be doing, Yeah.
I think that's great advice. And I think that's, an excellent note to end on. Anita, is there any last things you want to plug, promote, before we go?
No, not really. I mean, we talked about my company and, I'm so happy for this chance to share about what Rendr is doing. If anyone is ever interested, just, reach out. We have, rendr.com. I'm thankful for you for taking the time to interview and setting this up. And, I'm really happy to see how this will take us in the future, being a PA and especially being an Asian PA. So I'm excited. I think there is a lot more growth for us as PAs in the future.
I agree. I'm looking forward to our future, the future of our profession. And I appreciate taking the time to chat with us tonight. Anita, it's been a pleasure. Listeners, check out Rendr, check out PAAH as always. And thank you for signing out with us. Thank you for listening tonight. Anita, have a great
Thank
night.
you. You too. Bye.
Bye.